I'm Dr. Hafeez Rahman, gynecologist and chairman of Sunrise Group of Hospitals. You are watching me on webindia123.com. Basically, laparoscopic surgery is the entire spectrum of keyhole surgeries. Means today keyhole surgery is there in every part of the body. Lapro means abdomen. Scopy means seeing inside the abdomen. So when you see inside the abdomen, it's basically called laparoscopic surgery. And when you do by seeing inside the abdomen, when you do the procedure, it's basically surgery. Same way, if you talk about arthroscopy, that is inside the joints. Thoracoscopy is inside the chest. So like any part of the body you can do a scopy, and that is called that particular scopy. Now laparoscopy, the difference in open surgery and laparoscopy is that previously when we used to do surgeries in any organs inside the abdomen, say like uterus or ovary or intestines or kidney or any other organ inside the abdomen, what we used to do is we used to open up the abdomen by a 10 or 15 centimeter incision. We cut open the abdomen. So all these organs, they come out of the abdomen, and then we do the surgery in that organ, replace the organ into the inside of the abdomen, then suture the abdominal walls back. Now the entire thing of keyhole surgery has come because of the complications which are produced by this large incision. This large incision allows the internal organs to come out of the body, and these internal organs will get dried up completely, and it will produce lot of adhesions. Adhesions means it will stick together. And there is high chance of infection because you are putting your hand into the abdomen, the internal organs are coming outside. So in laparoscopy, what is basically done is, in a layman's term, it can be called as a keyhole surgery. In this keyhole surgery, what basically is done is, you have a small incision of 5 millimeter. Through that you are putting a telescope inside the abdomen and a camera. Once you put the camera into the abdomen, you can see the organs inside the abdomen very clearly. The entire concept before was, when you look through this keyhole, it was like looking through the keyhole. When you look through this keyhole, you will not see the things beyond that keyhole properly. You can just see, but you will not see. But it's not like looking through a keyhole. The camera and the telescope is going into the abdomen. It's like putting your head through the keyhole and looking around the whole area. So that means you are actually entering inside the abdomen and you are looking around. So the vision actually is much better than what you can see by opening up the abdomen. When you open up the abdomen, you have retractors to pull the muscles backwards and forth. And in laparoscopy, nothing is retracted. The intestines will fall back and you can see the picture very clearly. One advantage which has come in the recent past is that the cameras have developed very well, and the cameras are all high definition, high enhancement, so that the picture seen by the person will be much better than open surgery. You know, the entire surgery depends on how good you can see the picture. When you can see the picture at much better enhancement, much better lighting, like when you shoot a picture, when you take a photograph and put it in the National Geographic magazine, or a good photograph taken, looks much better than actually what you are seeing. Actually what you are seeing with your eyes, the photographs looks much better than what you can see, because of the enhanced mode, because of the magnification, because of the clarity of the picture and the newer techniques of newer cameras, high definition cameras, all those things. The vision in laparoscopy is much better than open surgery. That is the reason, even though when we started laparoscopic surgery, we were all telling that the only reason is you can do the surgery through a very small incision. The patient does not have much pain, no scar, all those things. But today, what has happened is, over a period of time, laparoscopic surgeries have become much better than open surgery, and it has started giving much better results than open surgery. That is why today we are preferring keyhole surgeries. Not because just for cosmetic reasons or simple reasons like pain is less for the patient. If your surgical results are anyway inferior to what you can get in open surgery, today there is absolutely no justification in doing a keyhole surgery. This is same in any part of the body, not only laparoscopy, whether it be thoracoscopy or arthroscopy or anything. The idea behind doing the surgery should be that the patient gets better cure, the patient is more comfortable and the surgical results are better. So this is exactly what is laparoscopic surgery. There are two things, one is 3D laparoscopic surgery and other one is robotic laparoscopic surgery. In 3D laparoscopic surgery, what is done is just like the 3D TV, because you have some three-dimensional picture which is coming and you can put the specs and see the picture so that it looks exactly like what you are seeing with your own eyes, so that the depth is perceived. Usually in a 2D picture you are not perceiving the depth, the picture clarity will be there, the depth is not that much perceived. So here in 3D picture the depth is perceived very much. So that surgery, this especially suturing and certain other things are much better done. Robotic surgery is a totally different thing. Robotic surgery, what happens is, in a normal person, suppose a person has little tremor, that is shivering of the shaking of the hands. Not everybody can have a very steady hand. In robotic surgery, when there is a little tremor also, say 1 millimeter tremor, in laparoscopy the whole picture is magnified on the screen as a 2 millimeter tremor or 2 centimeter tremor, is 20 times magnification. So you get a much, it's like doing microscopic surgery. In robotic surgery, normal human tremors, fatigue, everything will be filtered. And when you go inside, your surgery will be little more perfect. But today, robotic surgery, the biggest problem is become very expensive. And the difference from the if it is a very good surgeon, there is absolutely no difference between robotic surgery and the human robot. That good surgeon acts as a human robot, and we always feel that the human robot sometimes is much better than the usual robot. But in case of a poor surgeon or an average surgeon, this increases the skill. Using robots will increase the skill of the poor surgeon and an average surgeon to a good surgeon. That is the biggest advantage. And robotic surgery, it's not that robots are doing surgery. It is a robotic arm. And this robotic arm is controlled by a human being who is sitting behind the robot. So basically it's a human being only who is doing the surgery, but the human being is at little more relaxed, and the tremors, everything, those things are filtered when it comes to the robotic arm. So that is robotic surgery. For basically what a layman has to understand is that for a very good surgeon, robotic surgery is not of much benefit. But laparoscopic surgery requires lot of skill and lot of learning, very long learning curve. So not many people are able to learn laparoscopic surgery completely, and that is the biggest advantage of robotic surgery. With robotic surgery, many people are able to pick up laparoscopic surgery much faster than before. But then the cost becomes very high in robotic surgery. Limitations of laparoscopic surgery basically is the surgeon. It depends on the training of the surgeon. Previously, when we started laparoscopic surgery, we had lot of limitation. We used to say that this much big tumor only can be done, this many fibroids only can be done, so many limitations, so many other cancer surgeries cannot be done. But over a period of time, now we have done thousands of cases. We feel that inside the abdomen, there is nothing which cannot be done laparoscopically. Now coming to cancer, cancers also had lot of limitations before. But today we have reached a stage by which almost all cancers are done laparoscopically. Not done laparoscopically, it is better done laparoscopically, because the results are much better when it's done laparoscopically. So basically tomorrow it's going to reach a stage, or even today, even if you see gynecology and many other surgeries, it has reached a stage that 100% of surgeries are done laparoscopically. So basically what I feel is the only limitation of laparoscopic surgery is the surgeon. How well the surgeon is trained to do that particular job. So that will be the only limitation. That is why some doctors, they are not able to do certain procedures by laparoscopy, and they recommend open surgeries. Basically, laparoscopic surgery, the cost is at par with the open surgeries. It's not at all more than open surgeries. The reason why laparoscopic surgery initially when it started was more costlier, because this type of surgeries are highly equipment oriented. So there was an investment of equipment and the bigger hospitals started investing in this equipment before. So then the bigger hospitals, naturally the cost was high and there was a monopoly and there was a higher cost for laparoscopic surgery. But actually if you see the expense which is incurred by the hospital, today every hospital is having laparoscopy. So the expense which is incurred by the hospital, the expense is comparatively less in laparoscopic surgery compared to open surgery, because the patient stays only 1 day in the hospital compared to 5, 6 or 7 days in the hospital by open surgery, and there is a lot of dressing and sutures and so many things which are used. So basically cost is less or at par with open surgery in laparoscopic surgery. But suppose you say look at the nation, or suppose you look at the individual who is spending the money. For him, if you calculate the total expenses, you find the cost he is spending for this particular surgery is much lesser. Basically because he is not losing his work. The bystander is not losing his work. Otherwise in open surgery, one person is coming and staying with this person in the hospital for 7 days. 7 days loss of work for himself as well as the bystander or the person who is accompanying is a big loss of work and is a big loss of revenue for the individual. So if you calculate all those things, the cost is much lesser with laparoscopic surgery compared to open surgery. Almost every surgery in the abdomen can be done laparoscopically. Today, there is actually no surgery which cannot be done. Maybe 1% or less than 1%. In gynecology, I am a gynecologist. In gynecology, if you see, 100% of the surgeries can be done laparoscopically. Almost for the last 6 years, we have not opened up a single patient to do an open surgery in gynecology. We are doing something to the tune of 200 to 300 surgeries in a month. And out of this 200-300 surgeries, not a single patient is opened up. The only surgery in the uterus which is done open surgery today is cesarean, because you cannot remove the baby piecemeal. That is the only reason why a cesarean is done by an open surgery. Otherwise 100% of surgery, whatever be the size of the tumor, say fibroid, whatever be the size, whatever be the numbers, whether the patient has undergone previous surgeries, whether the patient has has any medical complication, whatever it is, laparoscopic surgery is the best. Say urology. In urology, radical prostatectomies or cancer surgeries of the kidney, everything is done better laparoscopically. If you see other problems like hernia and all those things, laparoscopy is today far superior in treating hernia compared to open surgery. There were debates before, but today we have come to a standstill on debates between open surgery and laparoscopic surgery in medical forums. Basically because in medical forums we don't even discuss whether open surgery is better or laparoscopic surgery is better, because it is accepted world over that laparoscopic surgery is far better and everything can be done laparoscopic surgeries. Even esophagus, that is the tube, the pipe which is coming from the mouth to the stomach, even removing the esophagus is done laparoscopically, completely laparoscopically and with thoracoscopic help. So all those things, previously the patient needs to be cut open completely, and these things are not done today and it should not be done today. This is a very important question, whether for the surgeon which is easier, open or keyhole surgery. It depends on the surgeon, because for the surgeon who is doing keyhole surgery every day, keyhole surgery is much more easier than open surgery, because basically you don't have to open the patient and you don't have to close the patient also. Means opening and closing itself is a big job. But for a surgeon who is not used to laparoscopic surgery, it becomes very difficult for him to do laparoscopic surgery. For a surgeon who is not skilled at laparoscopic surgery, it becomes very difficult for him to do laparoscopic surgery, and the basic problem is he will take a long time. Usually hysterectomy, when we take 30 minutes for doing a hysterectomy, there are doctors who can take even up to 5 hours for doing a hysterectomy, which kills all the advantages of doing a laparoscopic surgery. Basically, laparoscopic surgery is faster than open surgery, because the time taken for opening and closing the abdomen is not there. You just go in 2 seconds and come out also in 2 seconds. So it is much more faster. And for a good laparoscopic surgeon, it is like painting on a canvas. He can see the entire picture in the screen. The picture clarity is better. The lighting is better. So the surgery is also much easier, because surgery depends on how well you see, how good you see, and how good you can do the surgery. So if all these combinations come together, for the surgeon also, laparoscopic surgery is much better. For the surgeon, laparoscopic surgery is better, and for the patient, is it better or not? For the patient, there are two angles. One is for a comfort of the patient, that is as such for the patient. The pain is much lesser in any keyhole surgery. The basic reason for pain in any surgery is the somatic tissue. Somatic tissue is the skin and muscle and other tissues which are cut open in a wide incision of 10 to 15 centimeters. And when you cut open the abdomen like that, those tissues are more painful than the internal organs. The internal organs usually are not painful when you cut the internal organ. They are painful only when you dilate the internal organ, or the internal organ becomes inflamed like an infection. Then only it is painful. In laparoscopic, in open surgery, the entire pain is because of the big incision. In laparoscopic surgery, this incision is reduced. The surgery done inside on the internal organs is almost the same as in open surgery. So that is the reason why the pain is almost completely negligent, and the patient usually is able to sit up in the same day evening and walk or do whatever he or she wants. Another advantage of laparoscopic surgery is the recovery of the patient. The patients recover extremely fast after laparoscopic surgery. 24 hours, most of the patients, 90% of the patients are discharged from the hospital. Not only they are discharged from the hospital, they are supposed to be back to work in 1 or 2 days. Some patients, they don't even believe that they can go back to work, or they can lift weight, they can climb step, they can do whatever they want. So they take rest. But most of my patients, I advise them not to take rest, and they are back to work in 3-4 days, and that will be the ideal thing. Not only that is the ideal thing, that is a big advantage to the patient, because when a patient moves, something like deep vein thrombosis and the healing in that area where I have operated, all those things are much better, because whatever done, the area where we have operated cannot be moved by the patient. In an open surgery, you advise rest because the area operated, that is the external scar, can be moved by the patient, and we are worried that the abdomen will burst open. That is why a patient is advised rest for 3 months, not to lift up weight, not to climb step and all those things. In laparoscopic surgery, there is no scar, or the scar is just 5 mm skin wound kind of thing. So it will never burst whatever the patient does, and that is why the patients are advised to move faster or move as normal as before, so that the internal wounds will get more blood supply and the internal wounds will heal. Another big advantage to the patient is infection. Patient benefits a lot in infection, because we don't have any infection usually with laparoscopic surgery. Since we have good sterile techniques, infection rates have come down drastically after starting laparoscopic surgery. Because the internal organs are not exposed, the hands are not going inside, only the tip of the instruments are going inside. So infection is drastically reduced in laparoscopic surgery. Not only all these are very superficial actually. These are not the advantages to the patients, but these are superficial advantage. The biggest advantage is that you are doing a better surgery on the patient. The surgeon does a much better surgery on the patient, and that is why the patient recovers. Because the surgeon is at ease when he does laparoscopic surgery. Surgeon can see properly when he does laparoscopic surgery. The lighting inside is much better in laparoscopic surgery, and the surgery becomes much better. Because surgery is much more clean, you have a bloodless field, you have better dissection capabilities in laparoscopic surgery. So the cure of the disease is much better, especially when you see cancer surgeries. The clearance is much better. Cancer surgery depends on how large or how wide you clear the patient of the tumor. The clearance of the tumor, the clearance of the lymph nodes, everything is much superior in laparoscopic surgery. So the patient benefits doubly on the cure of the disease, as well as the comfort of the patient. Today, it's very difficult for me to answer the question why doctors still prefer open surgeries, because I don't understand why still doctors prefer open surgery. All benefits are towards laparoscopic surgery. Today, if you say in gynecology, there is no reason to do an open surgery except that the doctor who recommends open surgery does not know laparoscopy, or he doesn't have an approach to a laparoscopic surgeon, or he cannot refer the patient to a laparoscopic surgeon due to maybe personal reasons or whatever it is. Otherwise, there is no reason why a doctor should do open surgery. Open surgery should be only failure of laparoscopic surgery. Maybe sometimes when you do laparoscopic surgery, you have heavy bleeding and your vision is gone, so you may have to do a open surgery. Those are the only reasons why you need to do a open surgery, not at all in a primary case. Primarily, all surgeries can be done laparoscopically. Today, I would even go to the extent of telling that, especially things like for removing uterus or gynec surgeries, it will be totally unethical for a doctor to do an open surgery compared to laparoscopic surgery. That is one question which is usually asked to us, whether keyhole surgery can be done in patients who are already had, say, 3 cesareans, 4 cesareans, or open surgeries, whether keyhole surgery can be done. Actually, keyhole surgery is better in such patients, because multiple opening of the abdomen leads to a lot of hernia and again lot of infection. And seeing the adhesions in open surgery, the biggest problem is you will get lot of adhesions. The intestines, everything will get stuck together. Even if you put your tongue outside for half an hour, you will find that it will become sticky. You keep your eyes open for half an hour, it will be sticky and it will be painful. So any internal organ needs a continuous lubrication. When you open up the abdomen and you put all the intestines outside, it will dry up and it can lead to more number of adhesions. So when these adhesions are there, when you again do open surgery, it is difficult to see the organs properly, but you find that in laparoscopic surgery, you can go through the adhesions and see the organs very, very clearly compared to open surgery. So what happens basically in laparoscopic surgery, then once an open surgery is done, it's easier to do laparoscopic surgery than doing an open surgery in such patients. Gynecological endoscopy is two things. One is hysteroscopy, that is seeing inside the uterus, and other one is laparoscopy. Previously, instead of hysteroscopy, people used to do DNC. It's a very common term which many people might know about it. DNC is just curating inside the uterus to see the specimen, or if there are any polyps or something, it comes out, then you take it for histopathology and see what it is. Instead of that, today DNC has become a very obsolete procedure. And instead of that, what we do is we see inside the uterus. We see inside the uterus and see whether there is any pathology with a telescope going inside the uterus, and you can see exactly what is the problem, and by visualizing the problem and you take a biopsy exactly from the problem. DNC is like a blind thing where you put in a curettage without seeing and then take it. If you get it, you got it. If you don't get it, you don't get it. So hysteroscopy becomes much better and much advantageous compared to DNC. Hysteroscopy, there are surgical hysteroscopy also. You can do a lot of surgeries through hysteroscopy, like removing fibroid, you can correct uterine anomalies, and there are a lot of other surgeries done hysteroscopically. Laparoscopy is also part of gynec endoscopy, that is, you are doing procedures related to gynecology laparoscopically. As I told you today, 100% of procedures are done in gynecology through laparoscopy. In gynecology, there is absolutely no role for doing an open surgery, and we do not recommend open surgery for any gynecological problems today. We have told most of the myths about keyhole surgery. Patients used to come and ask me whether to remove uterus, whether half of the uterus will be left inside, or whether it can be done completely, or it's not like a bomb blast, or it's not like a magic. The surgery done inside is proper surgery. If you are removing a tumor or if you are removing the uterus or ovary, we are removing the uterus by doing a proper surgery. So it's not something like you lyse the thing or you have a bomb blast and half the uterus is left inside and half is gone. It's nothing like that. So it is removed complete. Surgery done inside, as I told you, it's a proper surgery and it is much better than open surgery. Another thing is, many doctors even promote open surgery compared to laparoscopic surgery just because of the personal reasons or availability of laparoscopic surgery, not because of any other things, not because laparoscopic surgery is inferior or open surgery is superior. It is just because the open laparoscopic surgery in that particular place may not be available at all. That is the only reason why a doctor need to promote laparoscopic surgery. Another thing is, we used to have a lot of questions like large tumors, how do you remove laparoscopically? People used to say that if you remove a large tumor, half will not be removed because through a 5 millimeter hole, how can you remove such a 40 centimeter tumor? We have removed the largest fibroid in the world through a 5 millimeter wound. This was done in Delhi by me, and this is something like a world record. 5.4 kg fibroid removed, that is twice the size of a normal baby, removed through a 5 millimeter wound. It is possible. It's not a miracle. It is a fact that it can be done. It can be done very easily also. It is not that you are struggling to remove it or doing something very miracle like thing. It's a daily routine kind of thing which is done to remove large masses. It is not difficult when you are doing it on a daily basis through laparoscopic surgery. I am Dr. Hafeez Rahman, gynecologist and chairman of Sunrise Group of Hospitals. You are watching me on webindia123.com.